Center, and we're going to be doing some Botox today. We're just going to show how easy and quick it is and how I can just leave and go. And Dr. Lucas is going to walk us through on everything that needs to happen and what we're going to do.
Hello, I'm Dr. Lucas. Bree has come in and she has mentioned a couple areas that she would like Botox to help her with. Even though she's a nice young woman that has very pretty skin, she has a little bit of overactive lines here where she's probably tried to raise her brows in different times. So what Botox is a chemical that is blocking the nerve signal to a muscle, and it lasts about 3 months, and it allows us to balance the face with the various muscle pulls so that we can get a pleasing either shape or to help get rid of some of the wrinkles. So what I will do, because it always helps me, is to map out where I'm going to inject. We are weakening a muscle that is in her forehead that is meant for elevating. So we got to be careful not to create something that will make her brows fall. And so we are centered right through here, so that will not make things, won't interfere. Then she had also mentioned, I'll just mark a few of these here, that her right brow is a little higher than the left, and the way we can adjust that is the muscle around her eye is a big circle, and when it tightens up it pulls down the brow out here. It's also meant for forceful closure of your eye. So we can balance this brow and make it come up a little bit by leaving unopposed lift and taking away the muscle activity down below. So I'm kind of where the crow's feet can be as well. She's fortunate to be young and very pretty, so she doesn't have much of that. So generally speaking, a few injections in this area weakens that muscle and allows that brow to come up a little bit. So that's all we're going to do today, because she's a very young, pretty girl, as we mentioned, so she doesn't need a lot. But another area where a lot of people have concerns are the vertical lines that come up here, and that can be eliminated because there are two muscles that come like this and create that, and we weaken those. There's also one that's here, and we weaken that as well. So that by doing that, that'll allow those muscles to not function as actively, and that helps to get rid of that lines. In other words, kind of the mommy frown line. So now that we've already marked out our little plan, we use a little alcohol. Always clean the skin. This is a procedure. I'll just have you put your head back. Just relax it there. And we try to use the least amount of Botox to get the effect that we are. And I'm just going very superficially here to get the effect. You see she's not feeling that too much, it's just little pricks. So Botox takes about 5 days to begin to be active, and then you will find that it reaches a peak around 2 weeks, and it should last for 3 months for the people that are just starting to use it. If you've been using it a while, you may get 6 months out of it, ultimately. And then I'm going to go around the eye, as we mentioned, to weaken those depressors. I'm going very superficial because that muscle is very close to the skin. We don't need to go very deep. Alright, and as you can see, in most cases we don't get any bruising unless we have inadvertently hit a little vein, which sometimes we can't help. As you can see, she could easily put a little makeup back on, go to dinner, and resume her normal life.
Good to go. And we're done.